This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Is it sharing?
Yeah, we can see it now.
All right, perfect. I think Dr. Stevens is going to kick us off here.
Awesome. Thank you.
Hey, everybody. My name's Andrew. One of the fourth year residents. Nick and I will be presenting to you today. Go ahead, next slide. So I mentioned Nick and I are two of the chiefs in our class. Picture of my family. I have 3 kids. We're excited to be here. Next slide. We have some great leadership at University of Rochester. They're all super responsive to feedback from residents, and also truly have an open door policy with all of us. Dr. Paul is our program director on the left, and then Dr. Salim, Dr. Hopper, our associate program directors. Kathy Flanagan is our program coordinator, and Dr. Patel is our chair. All super great, super nice, and are really invested in residency growth and helping residents. Next slide. Kind of nuts and bolts. We're a categorical program. Our PGY1s are really connected with our program. They get 4 weeks with us during their PGY1 year. They also meet with the program director, Dr. Paul, once a month, so they feel really connected even as a PGY1. Let's see. We're also a growing program. When Nick and I started, we were 3 residents in our class, and now we've expanded to 5 in our most recent match class. And then we also have approval for next year having 6 residents that will match. And we also have hired a ton of faculty over the past 10 years and have a great faculty to resident ratio. A lot of great opportunities to work with some amazing faculty members. Next slide. Inpatient, we do 12 months of inpatient, and it's spread throughout the 3 years. We're at the our rehab hospital is connected with our main university hospital. We have 3 service lines: brain injury, spinal cord injury, medically complex, which our 12 months are broken up into different months on each of those units or rotations. We just opened up a new floor. We went from 20 beds and expanded to 30 beds just over this past year. And it's nice being connected with the hospital because we're connected with all other services in case we have any consult questions or need help or guidance, and they're able to continue to follow patients after they get admitted to us in our rehab hospital. Next slide. Also, this past year, we opened up a new ambulatory outpatient facility building, which is beautiful, really state-of-the-art. It's where we do our interventional spine rotations, our sports and MSK rotations, and we do a lot of our EMG rotations there. We get also opportunity in the outpatient setting to work with pain rotations and work at skilled nursing facilities and have pediatric outpatient experiences, and we get plenty of Botox and spasticity management in the outpatient setting as well. Next slide. So I mentioned our rotations. We have 12 months of inpatient. Most of the inpatient experience is done early in our residency. We do about 6 months during our PGY2 year, and then the other 6 months are split up between our 3rd and 4th years. But our program is really flexible and can really tailor that 12-month experience based on residents' preference and be a little bit more front-loaded or a little bit back-loaded if it's desired. We also get an experience in all the different subspecialties of the PGY2, which is really nice as far as for fellowship preparation and applications to get exposure early on. You get 1 or 2 rotations in spine, get a chance to rotate with the pain fellowship at the University of Rochester as a PGY2, and 1 or 2 months on sports and MSK, and get plenty of opportunities doing ultrasound and Botox during that month. And one of the, I think the great aspects of Rochester is our procedure volume. We, even as a PGY2, you get hands-on experience doing ultrasound guided injections, doing Botox, and even doing some spine injections as a PGY2. For myself personally, throughout the 2 years that I've completed in residency in PM&R, been able to do like over 100 plus ultrasound guided injections and several hundred spine injections throughout the past couple of years, just within a few handful of rotations. Next slide. So like a lot of programs, we have 18-month lecture curriculum. We do anatomy and MSK at the beginning of each year, which is a great starting point. Start as a PGY2. We get hands-on experience in ultrasound and EMG practice pretty much yearly. And our attendings are, several attendings are willing to do this offline, like either before or after clinic, to go and give us additional pointers on ultrasound or with EMG. We have resident seminars that we give each year, which is great for things that you can put on your application for fellowship. We do journal club monthly. We also do oral board practice twice a year and do plenty of board prep questions just as residents throughout the year in preparation for your self-assessment exam, which is in January each year, as well as in preparation for boards.
Great for me, Andrew.
Yeah, good.
All right. So just some perks of the residency. You get the maximum vacation days allotted by ACGME. So that's 20 per year. We're very flexible with this during your PM&R years. Our conference days do not count towards vacation days. So if you are interested in going to a conference, you will get 5 extra days per year to go attend those. You'll also get some support to go attend those conferences. It would be about 1,000 per year as long as you're presenting. We also get 5 sick days, 3 interview days, and 3 personal days. Personal days are something that our program institutes. It's just you don't have to really ask off in advance like you would for vacation. But if you're just feeling unwell or need a mental health day, that's what the personal days are designed for. We have a board review course that's covered by the program for seniors towards the spring months as they're getting closer to their testing time. We also get Q Bank and $300 a year for book money to help us with our studies. And just in general, Rochester has a low cost of living. Those are our perks. Our faculty, we have a lot of great faculty and we keep on hiring more good faculty. We have fellowship trained brain injury and spinal cord injury attendings that you will be rotating with. So you'll get the top of the line education for those specific populations. We just had a new member of our faculty, Lauren Chambers, join us. She's really involved with ultrasound education nationally. During your PGY 1 year, you will be seeing and meeting with Dr. Paul, who's the program coordinator, 4 times per year. So you start building a really good relationship with her from the start. During your PGY 2 year, you'll be assigned with Dr. Sarah Salim, who's also the head of education. But typically, at some point during your PGY 2 year, you start picking out your mentor for your PGY 3 year. And it's pretty not that formal. You just have to identify somebody. And so during your later half of your PGY 2 year, you're really starting to identify that person. And that faculty member will help you through your PGY 3 year and PGY 4 year. So for volunteer and teaching opportunities, these are great just experiences working within the community. They also are great for putting on your CV. So we work directly with our first year medical students in one of our programs called Scopes. I think it has a new name now, but it's an opportunity to teach medical students the importance of social history taking, especially as it pertains to function and rehab in general. That's always really exciting. MSK and spine teaching for second year medical students. They typically will join us in clinic, and we'll also get fourth year medical students and third year medical students who are interested in PM&R in on our rotations. And we have a lot of opportunity in the afternoon, or if we have a missed patient to teach them. We have an annual spinal cord injury fair, a brain injury walk, and 512 day. These are all Rochester community events where members of the community, for brain injury walk, it's for people to get together and help raise money for brain injury resources in New York State. And 512 day is a day when all our former patients from our inpatient rehab unit are able to come back, meet with the doctors and residents. And so we can really tap into seeing how their function has progressed over the months that we haven't seen them. Call, which everyone loves to know about. Our call is all home call. You take most of your call as a PGY2. So with 6 residents, you'll do 1 weekend every 6 weeks. And you'll do about 3 call days, call evenings a month. As a PGY2, you're really only doing 2 call days a month, and then as a PGY4, you are doing no call. After residency, we do, I think, match really well with fellowships and job opportunities. These are all our former chiefs from last year. This gentleman right here in the pink coat, he matched here for a spine fellowship. This woman in the middle, Dr. Fedorko, she really wanted to go back home to Michigan and be with her family, and she was able to obtain a nice job there in MSK. And Nick Grzybowski will be staying in Rochester, also will be doing MSK. The year before that, we had one of our residents match with Stanford Spine, and another one who was interested in pain matched with MD Anderson. And then the 2 others, or one other is doing an MSK job in Providence, Rhode Island, and the other is a medical director in Erie, Pennsylvania. So wellness, we have multiple wellness events each year. We usually have one in the fall, one in the winter, and one in the spring. This one was our last winter one. And we did some curling, which was a blast. We also have holiday parties, and just general, we get together outside of work. We were able to have a lake house party with our program coordinator, Kathy, this summer, which was really nice as it's been super hot this summer. It was nice to get out there on that lake. Here's us getting together. This one looks like laser tag over here on the right of the screen. In the middle, this was the sort of annual resident only get together, just trying to bring in the new PGY1s and trying to integrate them into our residency. Here's some axe throwing, pickleball, which Garrett is very good at. He and I crushed it that day. Here's some views of things you can do outside Rochester, New York. There's lots of golf here. The PGA Tour was just here this past summer at Oak Hill. There's tons of excellent hiking in upstate New York. I'm not sure where this one is from. Andrew, is this your picture? Oh, I think you're muted.
From the Finger Lakes area, just a little bit south of here at Stony Brook.
Here's some more from Andrew's hiking. We also have a nice little village of Pittsford. This is the Erie Canal going through here. It's a beautiful place to walk and actually run and bike. There's tons of biking that my partner really enjoys in the summertime. Here's just some more of the, looks like Southern Tier region. There's a small snowboarding hill that I learned on called Bristol Mountain in this area. This is looking like the Genesee River, Andrew. It looks like he's bringing his kids out for kayaking. It's Highland Park. Rochester has lots of festivals every summer. The one festival that kicks off sort of the festival season here in Rochester is the Lilac Festival. This is a picture that I took from that festival, PGY 2 year. So lots of drinking, lots of fun, lots of festivities, live music, and the flowers are beautiful, and they're all blooming at the same time. It smells amazing. This is one of our co-residents, Chelsea, over here. She's visiting the Memorial Art for friends. Our biggest. He loves to go to the Adirondacks, challenging hikes. And this is Kenny, who's a big golfer and hockey fan. He plays in a club league weeknights during the winter. Here's Chelsea again. She's an avid runner, and she's also big into research and going into conferences. So here's her with some more of her colleagues. And this is us practicing some EMG and Greg presenting some of his research. So I know this time is pretty limited on here. So we just want to give you guys an opportunity to reach out to us. Here's our Instagram handles. Feel free to reach out. Looks like we have probably five-ish minutes for questions. So we'd be happy to take those.
If you have a question, how is board prep formatted? We do for like the written boards that you take at the end of your residency. We prep by doing like a question, one of the Q8 questions each day, just on one of our group chats, and do that daily. And then we probably like once a month, maybe 1 or 2 times a month, we'll have dedicated hour in our lecture time, where we have lectures every Thursday morning for 4 hours, and like maybe once a month opportunities where we just go through questions. It's like usually resident run, where we just take turns going around answering questions and talking about why, like what the answer is and how to approach that question. And those become a little bit more frequent as we get closer to the SAE that's in January.
We got another question. Sorry, Andrew. All right, anything else you wanted to add?
Nope.
Do most people live around the hospital? So this is probably one of my favorite parts of Rochester. Monroe County is pretty much where everybody lives. The traffic is pretty minimal, so you can live anywhere within the county and still get to the hospital. So most people do live within 15 minutes of the hospital, but that's not to say that they live right next to the hospital.
And the other thing I say, Rochester is very affordable for buying as well as renting. And like myself, I own a home and a couple other residents bought. And I think just with the housing market here compared to pretty much everywhere else in the country, I think it's worth it. Do we have in-person rotations for visiting medical students or just virtual medical student rotations? We do. We
2
have
minutes.
in-person and virtual. I think we have a ton of virtual rotators this year and a dozen or so in-person rotating residents.
Awesome. Well, I think that's all the questions. Thank you all for your time and your consideration. It's certainly an exciting year, 4th year, and being able to look at these programs. So best of luck, and we hope to meet you out there on the interview trail.